I'm a registered dietitian.
I'm an exercise physiologist.
I'm a cardiologist.
I'm a clinical pharmacy coordinator.
I'm living with heart disease every day.
And I live with coronary artery disease.
What is medication noncompliance? It encompasses patients who are not refilling prescriptions, filling the initial prescription, discontinuation of therapy before it's complete, and missing doses or taking medications at the wrong time. It's been noted that up to 1/4 of adult hospital admissions are due to medication noncompliance, 125,000 deaths per year, and an estimated cost to the U.S. healthcare system of up to $100 billion per year are due to medication noncompliance issues. Why patients don't take their medications as prescribed, there's such a variety of things, some that are patient-specific and some that are more even healthcare system-specific that are out of patients' controls. One big thing that comes up often is cost of therapy. There's many ways of reducing cost of therapy. A few key ones that I would share is patients can actually split their pills to help reduce the cost of therapy. Now, not every medication can be cut in half or split into halves or even fourths, but some medications, let's say that you have a 40 milligram tablet and the dose is 20 milligrams, the patient can take a 40 milligram tablet, use a pill cutter for accurate splitting, and have a 20 milligram dose for about half the price. So some medications, 20 milligrams is actually the same cost as a 40 milligram pill. Using generic therapies can be a way to reduce costs of medication regimens. Generics are proven to be as safe and as effective as brand medications and are generally much lower cost than the brand medication. There's a few exceptions, so the patient can always check with their provider first, but that's one way to save cost of therapy. Another way to reduce cost of therapy is by looking at a patient's insurance coverage. Some insurance companies will charge the same copay for 3 months of therapy as 1 month of therapy, so the patient really can get 3 times the amount of supply for the same cost as 1 month's supply. And finally, there's also prescription programs available for some medications that can provide assistance with medications or even free medications based on patients' income limitations. Every patient should walk away with a new medication or existing therapy knowing the name of the drug, what it's being used for, and how they should take it, potential side effects, and their monitoring and follow-up plan for it. Sometimes all providers may not sit down and go through every medication with the patient, but I would encourage patients to really ask either their provider or pharmacist if they're not sure about any of those key components in knowing their medication regimens. The patient filling a prescription gets a whole list of adverse effects printed out, and how are they to know what they should be concerned with or not? What I would tell a patient is really to ask your pharmacist or ask your physician provider what would be the 3 to 5 most common adverse effects that I should even expect from this medication. Also, what would be the top 3 side effects that if they do occur, I should be concerned and let you know right away. You should also know that if there's reasons behind your noncompliance, whether it's side effects, inconvenience, cost of therapy, whatever it is, to jot that down when you think of it, and when you go and see your provider to share that information with them. There's oftentimes alternative therapies that may just be just as effective and safe as the one that you're on. It's very important for patients to share with their provider and pharmacist their entire list of medications. This includes not only prescription medications, but also herbal therapies that they may be taking, nutritional supplements, vitamins, anything like that, because these herbals, vitamins, nutritional supplements can actually have severe interactions with some prescription medications. There are many tools available to help patients remember when to take their medications. I would recommend checking with a pharmacist to see what devices are available. One key thing I recommend for patients to increase compliance is to tie their medication regimens with daily activities. So potentially, you brush your teeth every morning. That's when you take your medications. There's many resources available out there to help patients increase medication compliance. One I would refer you to is www.adultmeducation.com. And this site has many references available, including medication charts, self-adherence tools, even questions that you can ask your physician, provider, and pharmacist about the medications that you're on. My name is Laura Borsted Richardson. I'm a doctor of pharmacy and a clinical pharmacy coordinator in cardiology and intensive care.